Welcome to the Fibromyalgia Podcast. I'm Tammy Stacklehouse, fibromyalgia coach, author, and founder of the International Fibromyalgia Coaching Institute. The goal of this podcast is to empower you with access to the dream team of experts and coaches I've discovered are key to living the fibro life you love. From the comfort of your own home, and maybe even your pajamas, I'll help you take back control of your life and health. To help out with fibro fog, I always include full show notes and additional resources at fibromyalgiapodcast.com. Welcome to the Fibromyalgia Podcast. I'm your coach, Tammy Stacklehouse, and this is episode 79. In today's episode, I'm excited to be interviewing Dr. Jessica Drummond about her experience with long COVID. You may remember Jessica from episode 68, where I interviewed her about endometriosis. This is actually her area of expertise, endometriosis. As I read her bio in a minute, you'll hear she's written a couple of books. She has practice helping people with endometriosis. And that is really her area of expertise. But I have her here today to talk to you about her experience with long COVID. Over the last year and a half, since she first came down with COVID back in November 2020, back before we had vaccines, when we were all still quarantined, trying to figure this out, she contracted COVID. And over the last year and a half, she has struggled to get her health back. I know so much of her story is going to resonate for you. There were so many times when we were talking that I just thought, wow, that is exactly like my experience with fibromyalgia. And so I know you're going to relate. I also wanted to invite her on because as a clinician, as a healthcare provider herself, as a nutritionist, a physical therapist, she has access to a lot of research and other providers, just because that's her world. She had a lot more information than most of the people that I know and talk to about long COVID. She's done her own research. She's kind of done her own experiments using herself as her first guinea pig and has just a lot of knowledge and information to share. So I know some of you are listening to this podcast because fibromyalgia was the closest thing you could find to long COVID. This episode's for you. For those of you with fibromyalgia who, are struggling to find answers, are worried about COVID, or maybe, had fibromyalgia first and ended up with long COVID, this episode is also for you. For those of you who are just, interested in long COVID, wondering, what's going on with that and the state of research that's being done on COVID, this episode is for you as well. So what I hope to provide for you today is some hope and also a whole lot of information. So let me tell you a little bit about Jessica. Dr. Jessica Drummond is the CEO of the Integrative Women's Health Institute. She's also the best-selling author of Outsmart Endometriosis and Clinician to Coach. Dr. Drummond holds licenses in physical therapy and clinical nutrition. She's also a board-certified health coach. She has 20 years of experience working with women with chronic pelvic pain. She facilitates educational programs for women's health professionals in more than 60 countries globally, and she leads virtual wellness programs for people with endometriosis. Like I said at the beginning, endometriosis really is her area of expertise. She's also one of the healthiest people I know. She was even scheduled to be the commencement speaker for our Stories of Hope and Healing event back in January 2021. When she came down with COVID in November 2020, we both thought she would have no problem speaking at our event in January. That did not happen. And in today's episode, she's going to talk about that with you. And while Jessica is a licensed healthcare provider, of course, she is not your doctor. She's not your provider. Therefore, we want to be sure to be clear that the information in this podcast is not meant to be considered medical advice. It's definitely not intended to replace consulting with your own physician or other healthcare provider. But we do want to provide you information that you can take to your providers. If you're struggling with long COVID, the things she shares today could be helpful to share with your doctor. You'll also hear during our interview that there's really just a ton of research that she's done. And at the end of today's episode, I'll give you a little bit of information how you'll be able to access some of those additional resources. Just go to today's show notes, fibromyalgiapodcast.com/79. We will have the links to her resources, my interview with Jessica regarding endometriosis, and the link to the episode I recorded where I shared my own experience getting my COVID vaccine, as well as the protocol my doctor gave me to follow to help minimize some of the side effects of getting that vaccine. If you have not been vaccinated yet and plan to be, if you're worried about that, if you're planning on getting a booster, anything like that, I would highly recommend checking out that episode and talking with your own doctor about whether or not that protocol would be something you could follow. It made a huge difference for me. I did not have any side effects from any of my vaccines, even the booster. And so I've just had several clients that have found it super helpful. Again, we'll have all of those links on today's show notes. Just go to fibromyalgiapodcast.com/79. Hi, Jessica. Welcome. Thank you so much for being willing to come share your story and everything that you've been learning about long COVID. I've got so many questions.
Thanks so much for having me. It's my pleasure to be here.
Awesome. Now, as I said in your bio, you're actually one of the healthiest people I know. So when you were diagnosed with COVID way back when, I thought it was going to be quick. And I think you probably did too, but that wasn't what happened. Do you want to share just a little bit of your story there?
Yeah, so I completely agree. I got COVID in December of 2020. So pre-vaccine and all of that, but not in the very first wave, which was actually important. I got it from my daughter who got it from, everyone was isolated at that time. We were all schooling from home, working from home, but she is a teenager. And so she had this kind of small group of about 10 friends that they were allowed to hang out with primarily outside. But, it just started getting a little bit colder here. We were going to be on family sort of 100% lockdown for 2 weeks, knowing that that's kind of the incubation period at that time. And we were planning to spend that Christmas down in Florida with my parents. And I sort of in the back of my head was thinking, we're not going to really come home. We'll just stay there while it's nice and warm for a couple months. We'll see.
Right.
And I said, and she was like, but I really want to go out and see my friends. I won't see them for weeks. And I said, okay. So she went to one party for about 2 hours, even with a mask, but it was just at that point we were wearing Athleta masks, not N95 masks. So there was a lot we didn't know. So she got COVID and she got, pretty sick given that she's a healthy teenager, but she was, despite everything, fully recovered in 2 to 4 weeks. She was back snowboarding later that season, perfectly fine. I think to this day, though, to be fair, even she has a little bit of cognitive issues, a little bit of changes in her brain slightly. I had to do a lot of work on healing her gut afterwards. So, she recovered, but COVID had an impact even on her body. Mm-hmm. And we were pretty isolated. She followed all directions, she stayed in her room. We brought her dinner. She was in there for 2 solid weeks, except the bathroom is in the hall. So, and then you're the mom. So you can't not go in there and check on your kid. And, we were FaceTiming the doctor who did absolutely nothing at that point because they were just like,
because they didn't know.
I think you'll be fine. Yeah, they really didn't know. And the true expectation by my doctor, my daughter's pediatrician, myself, pretty much everyone I knew, even clinically. My background is as a nutritionist. I also have a license in physical therapy. I've been treating patients for 22 years. So I know a lot of people in medicine just as like personal friends. And really the expectation at that time was you'll be better in 2 weeks. Some people it takes a little longer, maybe a month, but my positive test was December 16th, and I figured by Christmas I'd be good. Well, Christmas, I was in the hospital and I was struggling to breathe. And it was really interesting because my case was super mild for like 7 days. I had a mild cough, 1 day of kind of like sleeping fever. But then I started getting this weird, I said at that time, I have full body vascular pain. Like as a clinician, you have like a map in your brain of where all the vessels and nerves are and stuff, like the inner sides of my arms, the insides of my legs, just everything was burning. It was like fuel had been lit on all of my vessels. And I was taking a lot of antiviral stuff and herbal medicine. And, my vitamin D level was amazing. My zinc level was amazing. I had the right blood type for the research that was out at the time that things should be fine. And so I'm not 100% sure that some of the antivirals that I took didn't exacerbate things, because some of them do potentially have some blood pressure issues. But the other thing that happened was I was isolated in my room for 14 days. And I do have like a bathroom in that little area. So I just stayed in there, and it was winter. I occasionally would like open the door and go outside to have a little like deck off the back. But mostly I was in there, and I had a humidifier going because it felt easier to breathe. But that actually caused some mold to grow on the back side of the like shade between the back door that I would go out of and the room, which I didn't really notice until we were like cleaning the room all up when I was leaving, when my husband was going to come back in there, right? When I was like better.
Right.
So there is some data that says that mold can potentially exacerbate COVID infection. Maybe that happened because like I said, everything was pretty mild until the last, until I hit like day 7, 8, 9, when it was really weird. Like my heart rate was like resting at 150.
Wow. I
couldn't calm it down. I would like it felt like someone just poured tar in my lungs, and I just couldn't breathe. It was just like, and I had to sit in like a certain position just to keep my pulse ox above that like magic 94 number. And I said to my husband the second night, I went into the hospital twice. Both times I just stayed in the ER kind of overnight, and then they released me, and they just gave me fluids and some other things. And I said, it feels like when you're giving birth and like, you're like, I don't think I can do this anymore. But at that time you're like, well, you will. And it's kind of almost over, like within a matter of hours, like this is going to end. So I looked at him and I was like, I'm so tired just trying to breathe like this, but there's no endpoint that I'm aware of here. So like, what do we do? Because at that point I was already on all the steroids and I didn't know another choice.
Right.
So I went into the hospital, and what happened to the second time was I was having like esophageal spasm. So they literally poured some like lidocaine, which is just like a pain reliever, down my throat. And then it kind of settled enough that I could breathe. So it was very weird. Like nobody knew what they were doing. They all came into like that isolated room. The first time I went in an ambulance, which was super stressful. But they were on it, the doctors were ready, and they were all in spacesuits because nobody had been vaccinated yet. And I could tell a couple of them were still kind of sick from COVID themselves. Some of the nurses were like, so it was a really intense. There were a couple moments that I wasn't sure I was going to make it. Like, this is a lot worse than I ever imagined.
Yeah.
So that was very traumatic. But then what happened was, so kind of the worst of it passed. My heart rate came down. The steroids more or less did their job. But I tried to kind of get back to life. And that next week, I was still like, I had tons of chest pain. My heart rate was like, I'd go to take a shower and it'd be like my watch. I wear like a fitness tracker watch. And it was like, great workout. And it was like,
I can relate to that as a fibro person.
Yeah. And you're like, thanks, but I just got out of the shower. Yeah.
Right. Or I just did the dishes or.
Yeah. And it was like impossible to like shower and dry your hair, where you like
Right.
shower and then you have to lay down for a while.
Yeah.
So I didn't even have a doctor. My gynecologist had retired. I hadn't been to a doctor in 10 years. So my husband had recently found a kind of a primary care nurse practitioner we live in Connecticut, so in the Yale system. And I thought, well, that's probably a good thing to be a part of. Maybe they'll be doing some long COVID stuff or whatever. I didn't even know the word long COVID, I don't think, at that point.
No, I don't think any of us did.
I was aware of it a little. Like I knew there was this post-viral syndrome that was happening. I just had zero expectation that it would happen to me because all the data was around like people who are, unfit and obese or metabolic syndrome. And I really,
asthma, diabetes, all those other things.
The kind of comorbidities, which I didn't have any of those things. So I saw this primary care doctor and she said, I think you have pericarditis. So she was a nurse practitioner and she did a really good job of quickly sort of diagnosing that, sending me to a cardiologist. Really like the next day, they did an echo, they did all that. So I had very aggressive treatment. I did have pericarditis for like that 3 months. I had a medical diagnosis. There was a known treatment.
And for people who might not be aware, that's inflammation around the
right?
heart.
Correct. Due to any number of things. But, it's a pretty nasty thing. Like it's no joke. It can trigger cardiac arrhythmias and other issues. So I had to be relaxed and take handfuls of anti-inflammatory drugs. And I was also doing anti-inflammatory eating. I immediately switched on everything I knew and did no grains and tons of vegetables and no sugar and, protein and cooking at home and healthy fats. And I was, making beet smoothies and all the things. Right.
And some of that you were doing before too, right?
Absolutely. Yeah. And I was doing a lot of this kind of like, just knowing we were in this hot spot. I live near New York City. The second time it was less connected because most people were working from home by then, but we're close enough to the city that anytime they had a surge, we'd have some kind of surge. Mm-hmm. And so, just all the things to prepare the body just in case, right? Thinking it would just be helpful. So I was doing a lot of that, but even more specifically and intensely from the moment I got COVID and all of us also from the moment my daughter got COVID, which was about 2 weeks before we did. So I was like feeding the whole family like that. There was no sugar. Like the kids would be like, can we have any dessert? And I'd be like, apples and peanut butter. And they would be like, okay. So
they're like, oh, mom.
They were really sick of that. I was like, that's so excited, because it's like Christmas, right? And I'm like, no Advent candy and no sugar.
Right.
And Claire was like, woo, more avocado. So
that's hysterical.
So, they were taking it in stride. And so I was doing all of these things, which I absolutely think were helpful. So as I reflect back on that acute experience, I think what exacerbated it, I think this is a more intense virus than most people are willing to admit. I think there are a lot of, now it's been 1.5 years since I've experienced this. And I know both colleagues who had it before me, who are still, living it, who 2 years out, who were very fit triathletes, physical therapists. There's a lot we don't know about risk factors. There's some we do now, having had a prior Epstein-Barr infection, which is pretty common, but I think more of an activated Epstein-Barr infection, which I did have. I had mono when I was a teenager, and then I had it right after giving birth to my first daughter, who was the one involved in this whole situation. Maybe that impacted her, who knows? So that is an underlying risk factor. There may be some genetic underlying risk factors. I do have sort of metabolic genetic risk, even though I've never expressed that. It exists. So there's still a lot of research to be done there, but it's certainly true that this virus is unpredictable at the level of knowledge that we currently have. So being in as optimal condition as you can be in is great, but there's a lot that we just don't know yet.
Mm-hmm.
So that's where kind of conventional medicine left me off. They were like, well, your pericarditis is resolved or whatever. Slowly just get back to your life, which I did, but it was like super slow. I was like, are you sure I'm better? Because I was still having a lot of symptoms, a lot of vascular pain, a lot of like, I'd take a walk and I'd feel like it was very vascular, feeling like throbby fingers and throbby feet and throbby head. And even driving, we were in Vermont, the kids were skiing a little bit in the winter, just driving up the mountain, I would be like in a vice. It was so weird. Like I started to feel what I now understand was dysautonomia, which is when kind of your autonomic nervous system, which is supposed to pretty automatically like shift your blood pressure and your vascular tone and your heart rate and things like that, your breathing rhythm, just it's like driving a manual transmission car all of a sudden.
Where you have to think about all those little
You do. You're like,
adjustments.
can't, because one of the reasons the shower was so hard is like, it's hot, you're standing, your blood pressure, your blood can kind of pool. You have to lay down and let that stabilize.
Yeah.
So then these weirder things began to happen, or at least I began to notice them because I was trying to kind of get back to my life. And, we can kind of go through that, but that's how I started to realize that this is a whole complete post-viral kind of syndrome. There's nervous system involved, there's vascular issues, there's inflammatory issues, vascular epithelium. And so I had to kind of piece together a strategy for healing these things. And also I learned a lot from especially physical therapy colleagues who had been in the first wave, who were like, hey, don't exercise.
Right. And I bet there was a lot of things that sort of went against, I don't know, your training a little bit, like don't exercise.
Yes. So that was hard because even like the cardiologist was kind of like, okay, you can now start walking. And I'm like, okay, so now we're talking, this was December. Then I had about 3 months where I was on all the heart medication. And so January, February, March. So now we're hitting like April. And, as I said, I live in Connecticut. So we have the traditional seasons, right? So it's starting to be spring. And I'm thinking, okay, by summer, I'm going to be on my paddleboard. I'm going to be back to my life. And that really didn't happen. Like I still was struggling to walk very far. And I couldn't quite understand it. Like, should I push through it? Should I not? Is this my heart? Is this my lungs? I still had a lot of shortness of breath. I would still wake up in the middle of the night, like out of nowhere, just heart rate way to the moon, couldn't control it. And it would happen like 3 or 4 times a week, huge hot flashes. I had a lot of sort of crazy symptoms. So it was very frustrating because at that point, then the cardiologist referred me to the long COVID clinic at Yale, which was great, but I didn't have an appointment until June, or no, was it June or September? September.
Wow. That's a long time to wait.
It was like 5 months later. So I was like, okay, well, I'll probably be better by then. So let me just put this together. So I wasn't. So this happened in kind of real time, but looking backwards, what I've realized is there's about 8 different categories of things that people with long COVID have to deal with, manage, screen for. And the thing is everyone has a little bit of a different experience because it depends on your underlying risk factors, comorbidities, just support. Like if everyone with long COVID could go to Bali for like 4 to 6 months and just
be
totally
waited on,
rest.
head and foot.
Right. Like everyone's cooking anti-inflammatory food for you. You're going to bed at like 9:30. Someone's watching your children. Someone's running your company. Someone's doing your job. You're just laying on the beach and whatever. I mean, the truth is you would probably fully heal faster. And it would be interesting to see a lot of my colleagues. So I'm in a kind of just a Facebook support group of other people that have long COVID who are either physical therapists or other health professionals. And that's been really useful because, it's like everyone has the training to talk about this at a high level, but they're also living it. And it's sometimes you just want to vent to those people.
Right, exactly. And you and I were talking a little bit before I hit the record button that not everybody was as understanding as you would have liked to have been, or, even asked you lots of questions about what you did wrong.
Yes, I think it was a very big shock for other people in kind of the integrative and wellness space who really feel like virus, we know how to handle that. Why is everyone panicking? What all the narratives, you could go down many rabbit holes there, but there was a lot of like, wait, what? You're that sick? No, this can't really happen to people that are this healthy. Like that, it's not how this works, And it was very difficult for them it's a scary thing to see someone that you would relate to in this degree of struggle so fast. And then as we were talking about, what was really eye-opening to me as a clinician who's worked with patients with chronic illness for 20 plus years, I know that they're gaslit all the time. And, especially because the vast majority of people with chronic illness and post-viral illness and this are women. Although it's interesting, the long COVID data, it's not the vast majority. It's maybe like 60%. But what's interesting about long COVID is so many people who have it are male doctors because they got COVID in that first wave when no one was vaccinated. And the viral loads were really high and, especially people in the hospital. And suddenly they're like, you guys know, really something's wrong with me. And people are like, really? I don't know.
I have to say there's a tiny little bit of me that's like, I'm so glad you got to have that experience.
Yeah.
Talking to them. Right.
Right.
Because
not me. Yeah.
So often those are the doctors who are doing that to us,
Right. And I would say that there's a lot of compassion now because this group of people was affected and are super vocal because they're like, no, I'm not going to live like this. Like, no, where's the research? Where's the testing? I'm going to Germany. I'm going, they're really thinking outside the box. They're looking under microscopes that they're buying on like Amazon. Like people are getting really innovative. And there has been a pretty decent flurry of research. Now, some of it is directed in the wrong way in terms of like, more mental health services, which I don't discount. We need mental health support, but this is not an in your head kind of thing, although that's absolutely a narrative in some circles. And I think that the challenge is that the truth is a little bit, it's both.
Right.
Of course, it's in your mind.
Because your brain controls everything, right?
Right. And it's a brain injury. So it's cognitive, it's vascular, and it's autonomic, which is, vagus nerve and calming the nervous system. And if you can't do that, you're going to feel anxiety, you're going to struggle with insomnia, you're going to get depressed eventually if you can't go back to work, if you can't walk, if you can't exercise.
Right.
So I think the challenge with that narrative is that the truth is it is both. And yet we have to be careful of studying this as if it's only that.
Right. And studying it as if it's only physical,
body,
right?
yes.
Like we need that combination.
Yeah. It's not just blood clots and it's not just anxiety, if you will.
Right.
So I think that's the one benefit of all of these male healthcare professionals actually having this is that the research bent is there. And there is also a pretty solid push towards really looking at ME/CFS and other post-viral syndromes, trying to not start at zero when we really aren't at zero. The research of other post-viral syndromes is relevant.
Mm-hmm.
So there are kind of 8 different things the way I see it. And I'm not sure anyone's exactly looking at it this comprehensively because, of course, the challenge, even with like the long COVID clinic at Yale, which I eventually did get to see and have been to a couple of times. And there are actually 3 long COVID clinics at Yale, a long COVID pulmonary clinic, a long COVID brain clinic, neuro, and a long COVID heart clinic, which I actually haven't seen yet or may never. that in and of itself is problematic, right? But that's how Western medicine is, that it's like, which part of you is broken?
Mm-hmm. Which
All of
hole
it.
can we stick you in? Which compartment do you need to?
Which department? Yeah. So even the pulmonologist there, he was just sitting and talking to me, and he was just like, I don't understand this. I had 3 guys on like ECMO, which is like the, most intense life support when they had COVID. And when they got out, it took them longer to recover, but they don't really have long COVID. They got better fully in a relatively longer period of time, but different. He's like, and then I have all these people who are very mild, or, didn't even get in the hospital. What I had didn't feel mild, but I wasn't hospitalized. I wasn't vented. I was really only on a few medications. And he was just like, I don't get it. And he's like, I really feel differently about how I treat fibromyalgia now. He kind of like literally said that. He's like, because clearly something is wrong. Like, it's so consistent. And I think that's the other advantage we have with this is you have 20 million people-ish in the US alone in the relatively small period of time presenting with the exact same constellation of symptoms, if you will. There's variation, but it can't be ignored, because it's like, well, all of these people aren't making up the exact same story. Like, that makes no sense. Where would you even hear that?
Right.
So it's been really fascinating from kind of a disability standpoint, because the truth is, like, and everyone listening to this understands this in their bones, but it's very difficult for people to deal with. You can be healthy one moment and not healthy, like literally disabled within a moment or a couple of days or a couple of weeks. And that's difficult for people to accept. And so there's a really quick to blame,
Right. We're looking for a cause, right? And you weren't in a car accident. Right. So there's no external thing we can point to that was like, after this, everything changed. I mean, except COVID.
Well,
but yet there's so many people who had that and didn't, right? So what makes you different?
Right. So 2 things happen. One, people who certainly were less healthy than me, hundreds of millions actually worldwide, maybe, and I think this is where the data is a little murky, are fine, are fully recovered. I think some of that is a little bit of an overestimation. I think we're just not really considering the sort of mild subclinical changes that COVID is imparting, because we're later seeing things like heart attacks going up within the next 12 months, or, there are more subtle shifts, that cognitive IQ points dropping from 1 to 7 points. So
that's interesting. My husband actually had COVID, I don't know, a month or 2 ago, and I was able to avoid it. Yay, me.
Good job. Yeah.
But, I hear him sometimes come home from work and be like frustrated just about like being able to get a certain amount of work done. And there's so many people out there who are probably feeling that same way and never had COVID, and it's not COVID, and it's just like work stress or whatever, or bad sleep, all that stuff.
Yeah.
And then there's a whole nother group of people that actually, maybe it's this thing you're talking about.
Yeah. So there are, I think, degrees of intensity of it, because I have a good friend who is young, really, really sick. She hasn't been out of it. She had first wave long COVID, and she's posted a story a few times over the years on Facebook. And she, is in her 30s, was perfectly fine. She hasn't been out of bed really in 2 years. Like, her husband has to help her get dressed, get to the wheelchair, to even go to the hospital. There are very, very significant degrees of severity. So if you kind of look at the 8 different factors, I think number 1, the virus itself can cause organ damage. So that's something that Western medicine is pretty good at rooting out and treating, if you will. Kidney failure or like kidney strain, you can test for that. Same thing, we can look at liver function testing, cardiac stuff, like true heart stuff. The vascular stuff is tougher, but if you're looking at like lungs, kidneys, pancreas, there are a lot of people get type 1 diabetes triggered by COVID. And especially that's happening in adults and children. The brain stuff is harder. Again, there's not like one test or one imaging thing at this point. But second would be, I would say brain and vascular, like microclotting is something that has been elucidated in Germany and South African research. Interestingly, people who have ME/CFS, their blood, if you give their blood to someone else who doesn't have that new person can't create as much nitric oxide in the vessels from that donated blood. So probably people with long COVID and ME/CFS probably shouldn't give blood. But then what does that mean? Does anyone who ever had COVID not supposed to do that? I don't know.
Right.
But so microclotting, lack of nitric oxide or dilation of the vessels could be systemic, but could also be part of the reason why the brain fog is such a big issue. Mm-hmm. And the vascular inflammation. Another theory by a different research group out of California is that essentially some of the proteins of the virus get trapped in some immune cells, some of the white blood cells, and then they kind of get old and stick to the side of the lining of the vessel. So that can be an issue, because one thing that I felt, which could come from either of those things, either little tiny clots at the level of the capillary or lack of oxygen exchange at the level of the vascular epithelium or the lining of the vessels, and then right at the cell. So I actually had exercise testing done at the Yale Long COVID clinic where everything looked normal, except there's not a return. And I didn't do the invasive tests. They did do some invasive tests though on long COVID people, where two things were seen. One, heart and lung seems to be working fine in the sense that the blood gets normally oxygenated with exercise and all of that. But then the ventilation, you actually breathe excessively, because as the oxygen or as the blood is coming back to the heart, it's still pretty oxygenated. Like it's supposed to sort of drop oxygen off at the peripheral tissues, the hands, the muscles, the feet, the whatever. And it doesn't.
It's like we're sending full trucks out and they come back still full. They didn't make their deliveries.
Yeah, like 75% full.
That's interesting. So your cells aren't getting enough oxygen, even though your blood is oxygenated. Oh, fascinating.
So if you feel short of breath, you feel this like air hunger, but your pulse ox, when they, do that little thing on your finger, is perfectly normal. So that's interesting. And the other interesting thing out of that study that the researchers there were telling me about is that when the trucks come back, they're also, let's say there's fewer of them, like there should be a certain amount of fluid in that blood that returns back to the heart. And it's not so much. It's actually less volume. You're losing fluid and you're not transferring oxygen. So that is a sign that we commonly see in ME/CFS and in dysautonomia, which often play together, because some of this has to do with how the little tiny blood vessels contract and dilate. Again, the nervous system supposed to control that automatically. We shouldn't be thinking about the dilation of our capillaries. We can't
because I can't.
Yeah. The thing is, you can't actually control that. So there could be little clots stuck in there. We've definitely seen people with long COVID have clotting issues. And I did have elevated fibrinogen, which is a clotting marker. I did have a lot of other clotting tests done that were, for me, negative, but for some other people with long COVID, they do come up positive. So that's definitely something to look for. So organ damage, lack of oxygen exchange at the tissue, reduced right heart filling, especially as somebody tries to increase their exercise and activity. The other thing that happens with increasing exercise and activity is more of those sticky white blood cells. So there's a couple reasons why that exercise could make this worse, that we don't know for sure which is the right theory, or it could be a little of both. Mm-hmm. Then the microclotting and the lack of nitric oxide is another issue. And the vascular lining itself is probably damaged. Now, I heard some good research on that from Dr. William Lee on a podcast, either right before or right after I had COVID. So I started taking pretty high doses of quercetin from the beginning, which is something that helps heal that. But what's also good about that is and there's quercetin in apples and onions. So like I was also doing things like eating lots of like vegan onion blended soups and, things like that. Throwing apples in the salad, why not? But I also was taking pretty high therapeutic doses of it. In fact, I still do. But the other thing that may do is there seems to be a shift in the immune system that activates mast cells or reduces histamine clearing, which is probably really familiar in your world.
Yeah.
Yeah. And we see this in endometriosis as well. Essentially, histamine intolerance. So two of the drugs that have been most used for COVID in general and long COVID are antihistamines of various, H1 blockers, H2 blockers. Quercetin is an H1 blocker. I was on famotidine for a little bit, which I believe is an H2 blocker, although personally that didn't really do much, but for other people, it can be really helpful. This is why I said like everyone's story is a little bit different. And then the other reason that can be helpful is the mitochondrial dysfunction. So the mitochondria get really burned out with this. Number one, they're starved of oxygen.
Right, exactly.
So that doesn't help anybody. But also there's just this driver of inflammation. What is that? Is it from, how the virus has kind of like flipped a switch in the immune system? Maybe. Could it be how it changes the vagus nerve and the autonomic nervous system tone? Maybe, because there is some research where if you have someone stimulate, so the vagus nerve is a nerve directly from the brain that innervates all of these like automatic organs in the viscera, right? It controls kind of calming down your heart rate and slowing your breathing and things like that. So if that's challenged, then doing some direct stimulation to the vagus nerve, which you can do. The simplest way for me to explain it is like, how it feels good to get your hair washed at the salon? That's a direct stimulation to the vagus nerve. But there are also little like electronic units that are used in research and a little bit in medicine that can stimulate that nerve in a more particularly measurable way. Although, study at the salon, sign me up.
I know, right? I was thinking the same thing.
Yeah. But we can see that as vagus nerve tone improves in that kind of research model, that people's symptoms do go away, especially the cardiac arrhythmia, some of the fatigue, some of the digestive issues, because it helps the digestive tract go. That also can be impacted by the histamine issues. So that's another kind of something to be looking at. And then the gut microbiome. And in general, this idea of viral reservoirs, or at least viral proteins being left behind. So viral reservoirs of COVID proteins have been found all over the body for as long as these studies have been done, most of them at least 15 months, still in the brain, still in the gut, still in the eye. One crazy thing that happened to me is my right eye vision just like was an issue one day.
So are these reservoirs, are they just like pockets of where the virus is just hanging out?
Right. Like, so the thing is, it might still be there, kind of like Epstein-Barr can kind of be quiet, or all the herpes viruses.
Right. Shingles, chickenpox, hiding out.
Yep. Cytomegalovirus. So it's potentially like that. So the way I've really addressed it layer by layer is first, heal the obvious organ damage, the cardiac problem I had. Then interestingly, so I had this severe burning vascular pain and that really crazy a regular heartbeat, but only at night. I did a sleep study. I didn't quite have sleep apnea. They said something like, to qualify, you have to stop breathing like 5 times a night and you're only doing it, or 5 times an hour and you're only doing it like 3 times an hour. And I'm like,
right.
Isn't that enough? Like really?
Once seems a lot.
Right. So I did actually purchase a CPAP immediately after that. This went away. So who knows, or at least became less consistent. So I do think that's a key, because it was always during REM sleep. So
Yeah.
again, dysautonomia, the brain, right?
Yep.
So dealt with the cardiac issue. Then the second thing I did was just kind of throw mitochondrial support because I had that history of Epstein-Barr reactivation. I never really had fatigue because I was taking high doses of fish oil and magnolia and gosh, so many things over the air, quercetin, N-acetylcysteine. I was already doing a lot of vitamin D and zinc and vitamin A and vitamin C and K2 and all that kind of stuff. I was doing lots and lots of antioxidants and mitochondrial support through both nutrition and supplements, but also just things like sleep and sunlight and breath work and just really kind of taking care of the system in that way. And I think that's important as kind of like a step one, because some of the other therapeutic things to do require you have a reasonable level of strength, which is hard to do if you're like literally in bed. You know, you don't want to start like going after viral reservoirs that the body's kind of hiding for a reason.
Because that's how it's coping.
How it's protecting itself. Yeah.
It's like we are when we shove everything in a room and close the door and walk away. Right? It's
Exactly.
like I can't deal. So
I can't deal with this right now. Yeah. So you don't want to start like quote unquote detoxing the virus when your body is not strong enough.
Mhm.
So I had to kind of calm down some of the dysautonomia, do a lot of vagus nerve toning and breath work and meditation and nervous system calming and eating really healthy and balancing the blood sugar and all these kind of gentler strategies to get my body more resilient. And then I could move on to, so one of the things that helped me the most was then in April and May of, so this was maybe 4 or 5 months after I had my initial infection, I was eligible to get vaccinated, which scared me because no one knew if that was going to help you, make it worse.
Yeah.
And, you know, I certainly didn't want to experience any of that again.
No.
And I was tapped into kind of the research community, and it seemed like the chances were it was more likely to make you better than worse. And it probably wouldn't make you worse. It might do nothing, but that you would probably feel it. And I went into it really optimistic. I'll barely feel this. It's going to be one day, you know. Whew, I got knocked on my tail again.
Oh no.
but 5 days later, my heart rate stabilized and it never went back to being bad.
That's awesome.
It really helped me in a very immediate way. And then the second, but I also felt like total crap for a solid week.
Yeah, actually, would you just talk about that real quick? I have so many people who are so afraid of getting the vaccine because of exactly what you're talking about, being knocked on their butts for a week.
Yeah.
And to be fair, there are probably some people who have medical reasons why they shouldn't get the vaccine. But I think there's a lot more people who are just scared because they don't know or don't understand. So would you talk about that just for a minute?
Yeah. So I was very careful about trying to figure out the best vaccine option because I was lucky enough to be able to pick whichever one I wanted, which wasn't really the case with a lot of my colleagues in Europe. They have a lot more time off, but they don't have as much flexibility in their medical options. So I chose the Pfizer vaccine specifically because it was a lower dose than Moderna. And I figured, look, I already have some antibodies.
Right.
And then I didn't, what was the other option? Oh, Johnson & Johnson at the time, kind of people that fit my age and gender and stuff had more of a blood clot risk. So I thought,
Right.
I don't need that. And I would do that again. I think that was the right option. The Pfizer mRNA vaccine was the right option for me. And the data shows that now having one dose and an infection is pretty equivalent to 2 doses, or 2 dose and infection pretty equivalent to 3 doses. So the thing to be, I think, mindful of is you may not have to go through a lot of extra doses if you've either had some kind of COVID infection, even if it was mild, or you may consider, one of my colleagues is in a study right now. She has an autoimmune disease and a lot of my patients do. So they were really concerned, like, should I be getting vaccinated? And I said, it's tricky. It's a tricky decision when we were talking about it, because probably it will irritate your autoimmune disease. It'll probably irritate whatever other symptoms. If you have chronic migraines, it's not going to make them better.
Right.
It is going to flare you up a little, but getting the COVID infection is such a worse risk because it's an uncontrolled dose of the virus and all the proteins, not just some of the isolated proteins. So because our choice isn't vaccine or nothing, if my choice was vaccine or nothing, I'd choose nothing. But if you've already had COVID, my experience was that it helped me immensely. So I felt really sick. I had a fever. I felt crappy. I felt all the same pain I had with COVID. My heart didn't feel great. Like, it wasn't a lovely experience, but it was about a week. And then it really did let up completely. And then I was panicked to get the second dose. And the only reason I did was I was kind of like, look, I've come this far. I'm ready to just get checked off and move on with my life, because I was going to Italy that summer. So this was May of 2021. And I just was like, you know what, let me just do it. And I didn't necessarily think I even needed it for any official reason, because I was already vaccinated and one infection. But I just was like, if I'm going to do it, I better do it now, or I'm going to kind of chicken out. And I'm really glad that I did, because the second dose completely erased overnight the burning pain I had had every moment of every day for 5 months.
Yeah.
So there was some benefit, which to me shows that there probably is some viral reserve issue going on, because my immune system, when it got flared up, it cleaned some more of it up, if you will.
Right. Right.
So for me, vaccines were a very positive thing. I still don't want more. I mean, I got, if I don't need it, I don't want extra. But I really feel like, by and large, because our choice is not vaccine or nothing, it's vaccine or COVID, and even vaccine and less intense COVID. So family members of mine have had COVID since vaccination, and, with similar genes, have had some of this, but nothing like what I went through at all.
And I do think I actually had gotten my booster about 3 weeks before Scott got sick, and he hadn't had his yet. And I think that was one of the big differences between him getting it and me not.
For sure, because it's all about timing, really, with stuff like that, because are your antibodies still resilient? So interestingly, this colleague of mine who has an autoimmune disease, who did get vaccinated, she's been in a study where they're tracking what happens to the antibodies over time, to see when do people need follow-up doses. And for her, with just one dose and being really healthy, but also having this autoimmune picture, her antibodies are increasing. So in that case, it's an interesting question, which is great. She probably doesn't need another dose. So I think we can be a little bit more personalized around how much exposure we need, because there is new data out now that vaccines can trigger new autoimmune issues. So if someone's already got that risk factor, I think it's something to consider. But I think we have to put it into context. What's your likelihood of being exposed? I mean, I went on my first sort of trip since that summer trip in Europe, which everyone was pretty strict about all the requirements, and we had to be vaccinated and last weekend. And while people were by and large following directions, there was much less people are just done. So they're not strictly following directions. So I think you have to consider your realistic exposure risk and your realistic medical risk of being vaccinated versus having COVID, because mild or even completely asymptomatic COVID, study after study shows about 25 to 30% of people will get long COVID, and which is no picnic, let me tell you. And then you reduce that risk by about 50 to even 60%, probably in kids and adolescents, if you're vaccinated. So one, you might not get infected at all, which would be the ideal situation. And in fact, my family, so I actually got a second COVID infection in August of 2021, when we came back from Italy. I must have picked it up in the airport because I was negative when I left Italy. And then 3 days later, I was positive because I had to get a test to finally go to the long COVID clinic, which then I couldn't go to.
Oh no.
I was like, but my second infection was nothing. It was 2 days. I wouldn't have even noticed. I would have thought I was just jet lagged, except my Oura ring said I had a little fever and I was a little tired. I only knew because I had a PCR test at that time for that clinic. And then we tested the whole family and nobody else had it. So I think there are certain people that are just more vulnerable for any number of reasons, but I am continuing to test my own antibodies to make sure, because I would 100% choose a booster over another infection if I had the option.
Yeah, definitely.
So it's not fun either way. And I totally emphasize with how scared people might be, but you have to consider reasonable risk benefit.
Yep. And so before we go back to your 8 things, I just want to mention to our listeners, I did an episode 63, where I talked about my experience getting my COVID vaccine and about some of the things my doctor had me do leading up to kind of help mitigate some of the response. So if you guys want to check that out, just go to fibromyalgiapodcast.com/63 and you can check out that stuff.
Yeah, I think that's very reasonable. We did things like that with especially the youngest daughter, who had actually never had COVID, which is amazing. And my husband never got it. Mm-hmm. So to kind of wrap up, I really think that ultimately, so vaccine can be very helpful. Mitochondrial support is very helpful. Absolutely do rule out the more serious things because they are happening. And then it comes down to vascular epithelial support and trying to then, quote unquote, detox these viruses, which are probably co-presenting. They either were already there and then, made it easier for COVID to get involved, which is why that whole Epstein-Barr piece of research is so interesting, or that was triggered by the COVID infection. So I've been doing more antiviral types of herbs and medications in the last few months, and that's been really another layer of improvement. But I couldn't do it very quickly, and I couldn't do it all at once without die-off support. So things like detoxification support, castor oil packs, sarsaparilla, and
drinking lots of water,
charcoal. And you can't do this until you've opened the windows and doors, right? Till you're having good bowel movements, drinking a lot of water, healthy sweating response, stuff like that. And you really have to do that with a qualified practitioner, because you can make things worse if, like we said, there's a reason why the body hides it.
Mm-hmm. I see the same thing with fibromyalgia. Detoxing can be a great thing, but most of us are not in the place we need to be before we start doing that kind of stuff. And it So
really important to do that. So So I hope that's helpful.
It's definitely helpful. Now, I do want to be clear to everyone listening that while you know a lot about this and are definitely willing to help people that come to you, this is actually not what your primary practice is all about.
True.
So let's just briefly talk about that to put that in context for folks.
Yeah. So my primary practice is about chronic pelvic pain, and especially with endometriosis. So we do have a clinic, a virtual practice, outsmartendo.com. You can go and learn all about that. You can also go there and send me a note or, schedule a consult if you want to talk to me about your own long COVID experience. I can help direct you. I may be able to support you in certain ways depending on the severity of your case. But yes, endometriosis is really my first clinical focus. And I think, it's important to know that there is good research going on in long COVID, and a lot of it is informed by these other chronic illnesses like fibromyalgia, like endometriosis, like chronic fatigue. I think it's important to be really grateful to those communities who have suffered in a lot more silence because they didn't have the numbers at the same time. They weren't well believed, and you know this very well. And I think I'm hopeful, and it is the goal of a lot of the long COVID research is to not leave behind similar syndromes.
Absolutely. I read a really interesting article from a journalist the other day that he was unaware of chronic fatigue, fibromyalgia, like all of us who are sort of suffering in silence, until he started doing his research on long COVID.
Yeah.
And, realized that that's sort of sitting on top of this mountain of all of the rest of us too. So yeah, definitely. Well, if you guys are interested in checking out more from Jessica about endometriosis, we did an episode a while back. That's episode 68. So just go to fibromyalgiapodcast.com/68 and you'll get the episode on endometriosis. And I did just jot down a few of the things that she mentioned as we were going through audio. I know sometimes you're like, wait, what was that? How do I spell that? How do I find that? So I'll include a few of those things in today's show notes. Fibromyalgiapodcast.com/79 is today's. And of course, we'll have all that info out there. So thank you again so much. I know this has been quite a journey for you, and being willing to talk about all of that you went through took some time for you to be ready. So
yes, for sure.
Yes, I am so glad we were finally able to do this episode, and I'm thrilled to hear that so much is being done. Honestly, I had no idea. So
yeah, there really is. I mean, it could be better, it could be faster, but at the pace of medicine, this is pretty good.
It is.
Yeah.
All right. Thanks so much.
Thank you.
And that wraps up my interview with Dr. Drummond on long COVID and all the research that she's done surrounding that. I'm sure you could tell, listening to our conversation, that there is just so much more. We tried to hit on a few key things for you, but there just wasn't time to take a deep dive into all of the research, all of the things that she's discovered. So what we are doing is including some of that information as links on today's show notes page. Just go to fibromyalgiapodcast.com/79. And as she develops new training videos, handouts, whatever else related to long COVID, I will be sharing those links on that page. If you go there, the day this episode comes out, there might be a few things missing, and that's simply because she is in the process of finalizing some of these materials. So if you go, you don't see anything, just come back a few weeks later. We'll have the information out there for you. I also want to share this week's listener shout out for you. This was an email that I received from Barb. She said, "I love listening to your podcast. Your episodes are uplifting and have helped me change what I have been doing. I have recently moved from Idaho to Washington, and it sent me into fibro flares. I'm hoping I can find out how to tamp them down. Please know that your podcast has really helped, and continue your uplifting episodes." Thank you so much, Barb. And as you know, I sent you a few ideas for that. But for everyone who is struggling with fibro flares, whether it's because of a move or a change in weather or a change in stress, there are a ton of episodes that help with this. So if there's a specific symptom that is flaring up, then go check for an episode with that particular symptom, whether that's pain or fatigue. If you are dealing with just flares in general, a great episode is actually the last episode. In episode 78, I talked about how to build your flare survival kit and how to start figuring out what helps you feel better and what makes you feel worse. So go check that out. We will have links to all of Jessica's resources and this podcast episode, the Flare Survival Kit, all on today's show notes. Just go to fibromyalgiapodcast.com/79. And join me here for our next episode, which will be our Ask the Coach episode. This episode was inspired by an email I received that just simply said, "When will the pain get better?" I'm going to answer that question next time on our Ask the Coach. See you then. And that wraps up another episode of the Fibromyalgia Podcast. I'm your coach, Tammy Stacklehouse. For daily doses of hope, inspiration, and practical advice, come hang out with me on Facebook. Visit facebook.com/fibrocoach to find my personal coaching page and connect with me directly. To find the show notes, additional resources, or to schedule a consultation with me or one of my coaches, visit fibromyalgiapodcast.com.